One of the things that I encourage women to do after being treated for breast cancer is, of course, breast self-examination. Now, that isn't the only time I'm encouraging breast self-examination, but I think it's really important after being treated for breast cancer. I recently had a patient just last week come in, had a prior mastectomy, felt a tiny, tiny, tiny new nodule in an extremely unusual location. We worked it up, and unfortunately, it was, in fact, recurrent cancer. You've heard me say before here, just talking about her, you've heard me before here say there's no breast cancer surgeon on the planet that can guarantee that 1,000% of all breast cancer tissue is removed at the time of mastectomy. This example I've just shared with you is a perfect example of this. Breast tissue can occur from all the way up here in the axilla, microscopically now, down into the upper abdomen. And she's an example of this. Something in her case is driving her microscopic tissue to go on, develop breast cancer, etc. But what's the point of the story? There's a point here. Point is, she found this thing as a tiny little nodule. She found it because she does breast self-examination. She found it in between the visits to see me or any of our other providers. So breast self-examination is really important always, but particularly after you've had breast cancer surgery. So then what's the confusing thing about examining your breast? Well, with any breast surgery, there can be scarring. Not only is there scarring, but if you've had radiation therapy, the skin becomes thickened, it becomes more difficult to feel things. There's certain areas of the breast after the radiation therapy that can get really hard. That's often caused by an entity called fat necrosis. So there are all sorts of changes that are going to happen after being treated with surgery and radiation therapy. So what's important? What's important is that you get to know your breast after the treatment. And can it be difficult and confusing? You bet it can. And that, therefore, is where the experienced surgeon comes into play. And even for somebody as experienced as I am, it can be confusing. And so, therefore, we re-image patients, including mammograms. Ultrasound is a big help where there's areas of scarring. And if there's still any doubt at all, then getting a breast MRI is the way to go. So can scarring be confusing? You bet. Is it important to know the lay of the land of your breast after you've been treated? Absolutely. Want to encourage, keep doing that. Work with your surgeon, work with your radiation oncologist in learning in your breast after treatment what's scarring, what's not to worry about, and if there's any questions at all, insist on some additional imaging. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.